Yes, sir.
Very good afternoon. I have a few minutes to present my talk, and today I'm going to talk about what are the essential qualities to achieve success in ophthalmology. Most of the matter which I put together here is from one of the articles which we prepared, how to become best ophthalmologist, which was published in the Cataract and Refractive Surgery today. And in this article, we try to discuss some of the essential qualities of the successful ophthalmologist in the private practice. So as we all know, the private practice consists of dealing with the people. So the person who need to be successful is the people's person who enjoy interacting with the patients. And surgical skill is very important in order to fulfill the patient expectation. And the science and art of the ophthalmology is very important. But in order to excel with fine surgery, we should also learn how to communicate very well and how to satisfy the patient. And of course, there is a role of punctuality, and keeping the announced timing is also very important. And how, now the question comes, how the young ophthalmologist can imbibe these qualities. The young ophthalmologist, it's very important to fine-tune their surgical skills and also observe the successful models, as mentioned by Dr. Chitra Ramamurthy and Dr. Devasis Bhattacharya. It's very important to observe the successful model in order to imbibe these qualities. And today, ophthalmology is one of the most exciting branch which give opportunity to making a difference in the patient life. So by default, most of the young ophthalmologists end up starting their own practice even today. There are various models of group practice which Dr. Devasis Bhattacharya very nicely emphasized, and practice patterns are rapidly changing, and in order to stay ahead of these changes, we should also keep in mind of the shared facility group practices models so that we can stay ahead of these changes. One of the most important challenge in dealing with the branch of medicine or including ophthalmology is how to deal with the patients. Most of our patients are very happy, but once in a while you come across unsatisfied patients. And in ophthalmology, unsatisfied patients are quite not uncommon because of the tall claims and high surgical costs have convinced the patient that eye surgery is a 5-minute wonder. So everybody will get supervision. So that's why sometime once we should announce these things because of these announcements done by the corporate practice. So there is a very high expectation. So we should always deliver more, and that's under promise and over deliver. This we should follow this dictum. And once we interact with the patients, there is the clear path to patient interaction, which is connect, listen, explain, ask, and reconnect. So you can follow these guidelines which were taken from the review of ophthalmology, and this will help us to enhance patient satisfaction as well as the art of satisfying those who are not satisfied. So for young ophthalmologists, it's very important to market themselves, or image building is very important, and for that it's important to participate in various modalities which increase their presence. This could be delivering talk in the IMA or Lions Club, or in-house marketing, which was well covered by Dr. Vidushi. And in order to become very successful, you have to manage your staff, team members, and also doctors. So these are some of the take-home message which I put together in this slide: how to manage your staff and how to manage your doctors. And in order to take a leadership role for young ophthalmologists, it's very important to start practicing these leadership roles from early in the career. And other drivers of practice include that everybody is well trained and well geared for patient satisfaction. And it's very important, as Dr. Kures Muscati has shown very well, to achieve the work-life balance. And work-life balance is very important to manage the stress. So in summary, take-home message that for young ophthalmologists, you should start practicing some of these suggestions in the early of your career, so you can help your patient you can enhance patient satisfaction by your surgical skills and communication skills. Thank you very much, and I would like to just say we are working on this book on how to increase the satisfaction for doctors, and this will be published in next few months. Thank you very much.